This video is on hands-only CPR. Now, the people that usually need CPR are people that are having an abnormal heart rhythm or when the heart suddenly just stops. The heart's main job is to pump oxygenated blood all throughout the body, including the organs. So when the heart stops, the body is no longer able to send or receive the blood that it needs. So the organs begin to fail. Some of them can be replaced, such as the kidneys, liver, and even the heart itself, but not the brain. The lack of oxygen can cause brain damage in only a few minutes. CPR can keep oxygen-rich blood flowing to the brain and other organs until emergency help arrives.
You want to place the heel of one hand in the center of the victim's chest on the lower half of the breastbone. The other hand goes on top. You're going to straighten your arms and position the shoulders directly over your hands. This will allow your weight to help with the compressions. Chest compressions has to be at a rate of 100 to 120 per minute. And you have to press down at least 2 inches with each compression. This is a lot of hard work, and trust me guys, you will be tired. We have to allow the chest to recoil completely after each compression, and we want to minimize any interruptions to less than 10 seconds. For our little ones, we would perform CPR with one hand, but this really does depend on their size. The patient must be lying face up on a firm flat surface. The floor is an ideal place. High quality CPR can increase the chances of survival by 50 to 60%. It's important to work as a team and be able to alternate because, as stated, this is super tiring. Putting it all together. First, make sure the scene is safe. You want to tap and shout and check for responsiveness. Check if patient is breathing or has a pulse. If patient has neither, immediately begin CPR. Shout for help, have someone call 911, and get the AED. You want to give 5 sets of 30 compressions, and 2 breaths may also be given. Again, no more than 10 seconds. If unsure whether CPR is needed, remember, it's better to give CPR to a child who doesn't need it than to not give it to a child that does need it. CPR is not likely to cause any harm if the child is not in cardiac arrest. So if you aren't sure, provide CPR, you may save a child's life.